you have, you have the drainage protocol, and you also have the muscle toning protocol. But as you are all expert users of the machine, you can directly use the manual program when you enter diathermal contraction. And then what do we have here? We have the frequency, F mode, pause, action, T-rise, and T-fall. So, Attilio.
Okay. The F carrier is what regulate the frequency and so the deep of the radio frequency. So when we have to decide if we want to go deeper or to be superficial, more superficial, for example, on a phase, we can regulate. This is a machine that can go from 0.3 to 1 megahertz. That means 300 kilohertz to 1000. This is very important because it permits to regulate really the, you know, deeper is the lower is the frequency, deeper is the action of the radio frequency, the heating. Okay. Then we have the F mode. This is very important. The F mode is the muscular contraction. Lower is the frequency, more drainage you promote. It's exactly the contraction per second, no? So if we press mode, for example, and you see the white with the arrows, we can move to the every screen. So in the F mode, I can change this up to maximum that is 250. So from 0.1 to 250. This is the muscular contraction in the radio frequency that I want to give to the muscles. So higher is the frequency, more tetanic it is. I will tell you 250 is very, very strong in terms of tetanic because it's the number of pulsation, no, that we give to the muscles. 250 hertz is very high. It's tetanic. It's when you do really toning, when you want to really reinforce, no, and strong and make strong. So when you want a drainage, an effect of relaxing the muscles, or really give more distribution of the flows in the body, in the muscle, you use 3 hertz, 3 to 10 hertz. This is the exaggeration. Action and pause. Action and pause in the manual mode is when you want to give. When you want to, for example, lift an eyebrow, no, with the spheres, and you want to have a gymnastic so that the eyebrow, the muscle on the eyebrow starts toning, so starts to be in action, and then keeping the pedal, the foot pedal pressed, is the machine that decides by you how many poses we want to give. So it's like a gymnastic. What is the action and what is the pose? So we can select 5 seconds or whatever we want in terms of action of the muscles and the seconds of pause that there is no action. This is to create an automatic possibility. But if you keep this 0, the pause 0, means that the machine is always in action, always. So this doesn't make sense anymore, that you put 7 or 5 or 4, because if the pause is 0, is always in action. Okay, this is important to understand. So when you switch on the machine in the manual, the preset is 5 seconds, and the pause is 0, means that it's always on. T-rise and T-fall. T-rise and T-fall means it's especially used in physiotherapy, this, because the T-rise is the maximum power, how many seconds I want that the maximum action is reached. No, so if I decide to have a power of 30%, I will have my T-rise means that the curve to the maximum is growing slowly. It's not immediately. If I leave 0, is immediately 0 to 30%, no, when I press the pedal. But if I choose, for example, like 1 second means that my maximum is reached in a curve of 1 second. And the same is the fall, you can understand, you know? The rise up, the fall is down. So I decide that the fall has to be not immediately, but in a scale. And this for why for physiotherapy? Because in physiotherapy, when you need to rehabilitate a muscles after an injury, you need to give to the muscle an energy that is not immediately, not strong, but that grows and fall, you know, accordingly to the pain of the patient. TSL is the temperature target, but it's only available with the multi-action, but not with the spheres. So when it's available, you will see a light population. You will see a yellow arrow, means that is possible to select with pressing here the C button, see, and it's going up. So you have 4 levels: 0, 1, 2, 3, and 4. Okay. One most important are other 2 things: time. Okay, if you want to change the time. The mode of the thermic effect. This is another important tool, because the thermic effect is, if I want only muscular contraction, I keep it very low. Below the 20, it's more muscular contraction. If I go up, like 50, 60, 70, 80, 90, you have a more thermic effect. It means that the muscles are warm with the radio frequency. Power is the power. You press watt at the end. So after you select all the parameters, you press watt and you regulate the watt, starting from low. Always start low, because the patient has to be get used to the energy, no? So never start maximum, never start 60 or 70. It's very strong. So you start 20. They feel, no, they don't feel you increase. It's always good to increase than to decrease, okay? So this is the manual. And all these parameters are preset in our hand pieces that we select. For example, if you see here, the diathermy, it's only warm. Drainage, for example, it's already set. See, thermic effect 20%, the carrier is 450, and the other parameters that you cannot see here, but in service mode, you just have to know. It's already set. The frequency of muscular contraction is 3 Hertz, and there is no, and is always action on. There is no pause. But these are set protocols to simplify your work. So drainage and muscle tonus. These are the 2 that we already preset in this hand piece. If you put the thermogym, you will have many more others. If you capillary activation also. If you want manual, you go, remember the thermocontraction, you press start, and you have your manual area. Okay? Any question?
Well, this explanation was regarding the first of our questions, which was how to use and how to choose the parameters of the facial and body diathermocontraction.
Yeah, facial and body. You can use it's with any. This is referring to the MPs. So then you choose the MPs.
Okay.
For body or face. The only difference is that with the spheres, you don't have the TSL, the thermic level. With the multi-action, you can select.
Okay. And we have, for question number 2, it says, if a person has a lot of fat or cellulite, how long is the ideal time to obtain an excellent result with the cavitator?
Please, there is a question. No. Okay. Second question, yes. If a person has a lot of fat or cellulite, how long is the ideal time to obtain an excellent result with the cavitator? Listen, before there is an important information that you have to know. Cavitation, it works, it's a low frequency ultrasound, as you know, but the low frequency ultrasound, the ultrasound in general, they works in presence of liquids, of water. More liquids you have in the area, more action you have of the ultrasound. So in the case of our cavitator, the UltraCav 40 kHz, we always, in our protocol of a cellulite or fat, we invite doctors to combine the radio frequency only with heating, no muscular contraction, to increase the vascularization of the area, to increase the blood flow, and in the same time, water and also oxygen is very important. So in any case, before doing cavitation, you do 5 minutes on an area of 20 centimeters. So imagine like a half of a paper. This is your area of treating, and you do as always symmetric. So if you do one leg, you do the other leg after. You first use the capacitive electrode monopolar, that is the radio frequency to increase the heat, the volume of liquids in the area. Recall liquids, it's very important. We also developed this new tool that is great. After all the questions we can discuss, because it's great. This is a new thing, so probably you don't have, but this it's a big quad handpiece for large areas. For it is not you don't need return plate. It's a bipolar, but in a very large way that permits to heat the area very fast. So first this. After you can do cavitation because you have more action on the area of that you are treating. We can see with the model how to apply the application, but minimum is 15 minutes, 10 to 15 minutes, but not less, because it's really, and you have to stay focused on the area because you need really, it's not easy to destroy the fat cells. So it's not like you go and you destroy. So you need to stay on the area. You have to permit the bubble of water in the presence of around the fat cells, that they becomes like shotguns, but because of the cavitation effect, and destroy the fat cells, or they melt the fat, so promoting a lipolysis. This is the question, and then we can go deeper. Wait. Next, what is the function of braking and what makes it different from lipolysis? So when you connect the handpiece, when you connect the machine position on braking, if you see there is a duty cycle of 50%. So braking and lipolysis, already the word says, no? The word says braking means to break, to destroy. And in fact, the duty cycle is half, means that there is an action and pause that is at the same time. 50% of action, 50% of pause. This permits to obtain a braking effect. It's like a shotgun. It's like a little bit like a shock wave, no? Because it's not continuous, it's interrupted. Lipolysis is a duty cycles of 100%, means continuous. So you don't have interruption. It's a flow of energy of ultrasound that is always on. This promotes a melting, a lipolysis effect, not breaking. So it's more indicated on fat that is not really edematous, it's not a cellular, it's not orange peel. When you have big fat cells that also interrupt the flow of the blood, is very good to use the braking. promoting the breaking, or even the fibrosis. We have another function, okay, it's called fibrosis, and duty cycle is 5%. So it's very, very fast, high peak, but very fast, no? For fibrosis, because there are fibrosis septa, no? There are areas of the trochanter, especially the legs or the knees, that you need more action of destroying, and fibrosis is more like this. So the three of them are breaking, lipolysis, and fibrosis. Forget manual program, you don't need in this function manual program. I will suggest you just work, it's enough with the three.
Okay, thank you. Number 4 says, we are not taking advantage of the physiotherapy part. Could you tell us the functions of each parameter and protocols for the thermogen?
Regarding physiotherapy, if I understood, you want to know how to use in physiotherapy. Okay, look,
Exactly.
Thermogym is a great tool to work on muscles. So the muscles can be considered a problem in aesthetic, like ptosis, like less volume, so to increase the volume, etc. Capillarization and also drainage. But the same energy can be really used. We have a long tradition in physiotherapy as Brera, no? We were born in physiotherapy, so our background is there. That's why that we decided to keep some protocols for physiotherapy, because this machine is also sold to sport medicine, especially football clubs. Why? Because you can have hamstrings, plantar fasciitis, or problem of increasing the volume of muscles, because after a surgery, for example, surgery because you break some legs and you have to stay 1 month or 2 months without using that legs, the muscles, you lose totally the muscle. So how to recover this muscle? Okay, there are physical exercise, no? Like the walking, the run, the physiotherapies, but there is also an important help from the machine. And that's why we put some indications in the protocols that are muscle atrophy, for example, or okay, toning itself, reinforcement. Elastic power is really for sport medicine. Cramps, preventing cramps, because there are people that suffer cramps. For even people that don't do sports, for other problems, but especially in sport medicine, cramps are very important to prevent on the field. You know? The contraction after, for example, we give this machine to cycling team. So imagine after the cycling 200 kilometers, they need to decontract the muscles, because the day after they have another 200 kilometers. The fatigue is the same, similar. Okay, sagging skin, no, liporeduction, no, cellular. And that's it. So there are few of these indications that are also for sport medicine or physiotherapy. And if you have a therapist also for pain relief, is good, the diathermy itself, for pain on the back, on the shoulders, when you have contraction, decontracting the muscles of the neck, you know, the cervical pain. It's fantastic. It's fantastic. We really promoting aesthetic because it's the big market is there. But believe me, our background is really physiotherapy, and this machine, even with the other NPs, with this or with this, you can treat disease of the body, physiotherapy.
In any case, we have 20 pages of protocols for physiotherapy.
Yeah, we have protocols for physiotherapy and that you can combine with the machine. Even the cavitation, the fibrosis, it's used on the elbow, on the shoulder or the elbow, when there are calcification of the bones, to destroy and to create. There is another person coming. Okay. No, pudimos escoger la primera. Okay. Other question.
So, what
Number 5.
useful?
T-point, in the magician of this machine, there is also another tool. That is the T-point. T-point, this is used also in physiotherapy. Someone with the microphone. Okay. So T-point, it's as you can understand, it's very useful for wrinkles, for signs, for lines, because it's a very focused, strong heat in this point. But it's safe because you have the thermic sensor and you can control the maximum so that you don't create burning. The important is that you understand what are the limits when you move. If you move faster, you can increase the power. If you move slower, this can be a bit uncomfortable. So it's very important how to use it during the movement. But it's great because you really promote denaturation of the collagen fibers. It's monopolar, so you go really deep. And we suggest to use on all the lines like chicken feet and in forehead and the nasolabial. This is the most used part. You can use also on estrias, on stretch marks, but you know, as you know, it's difficult part to treat, but you can benefit as well. Few things. Regarding physiotherapy, it's very much used on the trigger point. So if you find someone that knows really the trigger point or the acupuncture, you know, the acupuncture maps, you can use this because on this tool, you can also have the pulsation of the electricity. So you have the heat and the electricity. So on the trigger point, you're going to stimulate and to decontract the trigger, and you can benefit if you have some specific pain on one area of the body. It's fantastic. So for both the application, but in aesthetic, it's for the lines. After on the model, we can see a little bit. We can show this because it's a tool that you know how to regulate. I can show you. Okay. Just I want to finish the question, then we can pass to the.
So,
Thank you.
protocol to achieve the best facelift results, similar or better to the one given?
Okay, listen. I heard about this question. HIFU is another technology. HIFU is focalized ultrasound. So we have a tool that I don't know if some of you probably has because it's an optional of the machine, but it's an important optional. It's called fractional RF, because if you want to do HIFU, mostly promote the denaturation of the fibers and the tightening and the firming, no? But after months, 3-4 months, you see the results. The only way is, okay, the spheres, you can use the spheres because it's an intense and deep radio frequency, and I suggest it. But to reinforce the spheres, you need the fractional RF. The fractional RF is our kind of, you know, RF made fractionated on 125 points that you create mechanical damage and the column of electrical damage of RF heat, so that you create a matrix on the skin to promote this intense collagen denaturation with a good tissue around that is going to be stimulated to produce new collagen and new elastin on the area that you're treating. So I will suggest, if you want a really competitive results with HIFU, you need this tool. You can use the spheres for sure. You can even use the capacitive on the face because it's a strong monopolar. But if you want to be really aggressive, you need this. Okay.
How long is the recommended time to work only on sagging facial skin, and which handpieces are the best to use? Sagging skin.
Sagging skin. Sagging.
So first, I think that we have to remind what is the genesis of the Imperium Med 400. So the Imperium Med 400 is a global working station for face, where you have different kinds of energies involved. So my basic protocol for face is basically with those two handpieces, the sonoblade for skin dermabrasion, and where you have another function for sonophoresis. I usually start the treatment by epidermabrasion, 5 minutes, and then I do some bipolar radiofrequency, 25, 30 minutes. And then once I've removed the gel, I use again the sonoblade in sonophoresis mode, okay? So this is really the basic protocol with the Imperium Med 400. And as Attilo was explaining you, what is really interesting with the Med is that you can make some additional cells to the treatment. Like with the basic protocol, all the patients love this treatment because it's really comfortable and patients see the results right after the session. And what is interesting, for instance, once after the treatment, when you are with the patient and that you analyze the results, you can easily sell some additional add-on with the machine, like for instance, by telling to the patient that next time it would be good to focus on the nasolabial, and we have a great handpiece to work on localized wrinkle. And you explain how the monopolar radiofrequency works, and you will easily sell some add-on for the next session with the patient. So back to the question about sagging skin. If you really have a patient that suffers from skin laxity, I would go with the fractional radiofrequency. I mean, with this handpiece, you can do face, neck, décolleté. Patients love it.
And sphere also. Spheres for the oval is good. Yeah?
Yeah.
Don't forget that you can use the spheres with the diathermo contraction. So this means that you can also stimulate the muscle, reinforce the muscle, and so it benefits also the skin. Absolutely.
Yeah, and then you have to understand what the patient wants. If the patient is more into comfortable treatments, you go with those technologies. But if you feel that the patient is ready to go to something more aggressive, you can add in the protocol fractional radiofrequency. So it's really a way for you to propose a wide range of treatments so that the patient can come many times per year in your clinic.
Yeah. Okay. Any question or no, we'll finish with all these questions.
Oh, we have 20 questions.
Any question? No.
We have no questions in the chat so far, so I think that we have to follow the ones that we have already. Thank you.
So there is the question 8, but I wasn't sure about the translation, Regina, because the capacitive resistive handle, and you are probably talking about the multi-action. Does this handpiece only works on fat? That was the question, right?
Exactly. If that piece only works with I understand that if that piece also works with fat, can you use it on fat or only on wrinkles? I think that might be.
No, this doesn't work. In Spanish, how was the
Tensado.
tensado? What is it? What is tensado?
Contracting.
Okay, so they want to know if this, because mostly we promote this for muscular contraction.
Okay.
So probably they want to know if we can treat also the fat with this. Look, for fat you have other things. You have this, you have the big board that is fantastic. This is monopolar, is resistive and capacitive in the same handpiece. So in any case, you can reach even the bones thanks to the capacity. Sorry, the resistive electrode. But it's not efficacious on the fat like can be the other handpiece. So since you have other tools, I will say use other tools. This is a bit more dedicated to the muscle contraction. Okay.
Okay, thank you.
G1 energy function, when do we use it?
Okay, G1, as you know, when you connect the handpiece that they have the sensor, like the capacity, the multi-action, the T-point, you have the thermic level. Thermic level is G1 is the very low, and then you can go up, no, with G2, G3, G4, or you can exclude, so means no control of the temperature. G1, honestly, is used mainly in physiotherapy, because in physiotherapy, when you have an inflammation of the area, the heat is not a good indication. So keeping very low, you promote the electrons movement, you promote the metabolism acceleration, but you do not promote the heating, not too much, because otherwise you're going to put, I say, alcohol on fire, no? It's not good. So that's why G1 is here. But in aesthetics, you start minimum G2 or G3. We don't use low things. Consider that this is not that if you use G3, if you use G3, but what control the quantity of energy is always the power. It's not this. This is only control of the maximum level. That when you reach the maximum here, the machine stops. But this doesn't control the quantity of energy, the power, you know. So when you, the only thing is that when you, for example, when you have G1 and you choose power, there is a limit. It doesn't go. It's a safety thing that we put. So maximum 25, you cannot go, because the operator has to be conscious to decide that he wants to go more. So G2, the power can go up to 60 and cannot go over 60. So the TSL is only a control, but it's not the quantity of energy in terms of power, because it's this that controls the power, okay?
Last question. Which protocol to use on hands?
On hands, I will use the sonoblade, because it's very important to give light, brightening to remove the dead cells. And the hands, you know, we have always the dead skin, no? Dry skin. So this, use it because it's fantastic. And then if you want tightening on the hands, you need the fractional RF. Because for tightening, you need a ref, but fractionated promotes more stronger tightening. Otherwise, if you don't have this, you have to use the spheres, because spheres is a good way to adapt to the area, no? Because the spheres can open, so they are very ergonomic in the hands, on inside between the fingers. Okay, so spheres is very comfortable to use, but it's most gentle than the fractional ref. Okay, so if there are no, we can show you a few things.
Can I ask you something?
Huh?
Can I ask you something?
We are here for you.
Okay, about this treatment of the hands, how many times about the radio frequency?
Sorry?
How many times you can use the radio frequency in the hands?
Hands, there is no limit. In the hands, you can use also twice a day, twice a week, sorry. Because it's the hands, I mean, the spheres, I'm talking about the spheres, because if you're talking about fractional ref, you have to give 15 days for repeating because it's really strong. But with spheres, especially in a power that is biostimulation or tightening, but is not such aggressive that you have to wait the skin to let's say to wait to
regenerate the collagen.
so
Okay,
twice
I understand.
a-
Okay, but I mean, in the treatment, like 5 minutes, 10 minutes.
So I would first
Yeah, sorry.
2 minutes.
For how long should the treatment be? Is that right?
yes.
Yes, thank you.
So you do
My
2
pleasure.
of dermabrasion on the hand, it will go really fast. And then you do 10 minutes of spheres on the hand. It will be mostly focused on that part and not you. I don't really treat the fingers in that case. So you can, but people mostly want to have this part treated. So I do it 10 minutes. And usually I use 25% of intensity in diathermy mode.
Okay, it's not necessary the contraction.
No,
Maybe it hurts.
No.
Yes, no.
because you
No, only radio frequency.
because on the hand, people mostly have some skin laxity. There's no muscle anymore.
It's more
Well,
an aging, you know?
yeah.
It's more an aging than a toning effect that you need.
Yeah, you don't have really sarcopenia on the hand. It's
No.
really sagging skin that you have here, like a loss of skin elasticity. So that's why the best answer for this is to create a natural collagenesis through radiofrequency with the spheres.
Okay, and can I ask one more?
Whatever you
Please?
want.
Thank you.
Please
It's
do so.
because we have some case and we don't see the best result. I know if you understand about tight the skin in face. Can I show you some pictures?
Of course. Oh, can we put her admin? Or Regina is also admin.
No, I'm not the administrator right now. I think that Maria Paula is. I'm not so sure.
Yes. She will allow.
I think that I can share this.
Now you can.
No.
Let's check this.
Come here.
She can share everything now.
Now, if you try.
Thank you.
Infatti, ask her the protocol she used.
Catherine, ¿ya te hicieron administradora?
Fractional.
Ya le hicieron administradora, perdón.
Déjeme revisar para ver.
Le dimos la
Gracias.
de compartir.
Gracias, María Paula.
¿Pueden ver la pantalla?
Sí, ahora ya podemos ver la pantalla. Ahí tienes la... Ya tenemos las fotos, antes y después. Before and after photos.
Ok, en este caso no pudimos ver como tantísima mejoría como hubiéramos querido en lo que es la flacidez de la piel.
She's telling us that they couldn't reach the most of what they expected about tightening the skin.
Can I know which protocol you used exactly and the frequency of the treatments?
Nosotros usamos la espátula, ¿verdad? La epidermoabrasión primero, luego utilizamos la radiofrecuencia por 15 minutos en cada zona y la diatermocontracción
Mhm.
por 5 minutos en cada mejilla.
Can you tell me the intensities and of diathermy and diathermocontraction?
Con la esfera.
Caro, usted tiene ahí el expediente de doña Alba.
Sí,
Para ver intensidades.
A ti te mandé la foto.
Regina, can you tell me the settings in for the radio frequency and the duration?
Okay,
Figures.
45%
Okay.
for 15 minutes.
15 minutes only. Yeah. No.
Yes. In both, okay, in
On both sides. Okay.
yes, and then the in 8% de diatermocontracción.
Mhm.
How do you?
En 880.
So first point. Okay. So dermabrasion, I think
800.
80?
800.
800 rating. That's what she's telling us.
800?
800 what?
800 what?
Catherine, el último número, disculpe, ¿son 880 o es 8.8?
880.
880. That's what she's confirming us.
880 what? The carrier,
La diatermocontracción fue en 880, 8% la intensidad.
8% of intensity and 880 the dermal contraction.
but in mano, she put in mano more. ¿Has utilizzato la función manual o la función automática?
Manual.
Manual. Así que has seleccionado la F-Mode 80
Yes.
como contracción. ¿Y la acción térmica?
45%.
Okay, but 8% of power.
Okay, in diatermocontracción, I don't use the effect thermic because in one case, the doctor said that it's not necessary to put the thermic effect if you use the radio frequency. Is that right? Or
Yes and no, because in my basic protocol, okay, as you did lipid but when I do a pure radio frequency protocol, I do at least 30 minutes of radio frequency in pure heating. But in that case, you just did 15 minutes of diathermy, and then you did muscular contractions without heating. But you can, when you use diathermocontraction, as you know, you have the possibility to use it with or without heating. Of course, if you did already lots of radio frequency, like the minimum for me is to have during a treatment like 30 minutes of heating, because if you just do 15 minutes of heating on the face, it means that you have 7.5 on one side and 7.5 on the other side, which is not enough to create a collagenesis. Because normally I really do 30 minutes of heating on the full face minimum. And this is why when in your case, if you just do 15 minutes of pure diathermy with the spheres, I would add thermic effect to reach at all minimum 30 minutes of heating. Do you see what I mean?
Yeah, I think. So diathermy for 15 minutes and contraction for more time.
Heating, yes, with heating.
Okay, okay.
And also, how can I know how you use the diathermal contraction, or if you move back and forward, or if you just stay fixed on one position, or how do you use the diathermal contraction on the spheres? Like the movements, which movements do you use with the spheres for the diathermal contraction?
Ok, sería como del mentón hacia arriba. Solamente en ese movimiento sabemos hacerlo.
Yeah.
She's telling us that that they began from the shin upwards. That's the only movement that they know how to do.
Okay, so what we can do maybe, because now that we install the patients, we will show you our way to use the diathermal contractions with the spheres. And normally I do it in two ways. I do back and forward, especially on the mandibular area. And also when you get some points, you can stay fixed. Are you gonna put your phone on? Okay. You have gloves already. We're installing another camera to have a focus on the patient.
Thank you. Nos van a enseñar, Catherine, la forma en que ellos utilizan el protocolo para utilizarlo, ¿verdad? Para ver si de esa manera podemos mejorar los resultados.
Muchas gracias. Muchas gracias. ¿Verdad que lo que él dijo es que es más tiempo?
Es más tiempo, son 30 minutos como mínimo y habló mucho del proceso de la temperatura, que tenemos que tener mayor temperatura para poder darle mayor forma. Pero igual, todo esto nos queda grabado y entonces tan pronto terminemos y lo tengamos, nosotros lo recibamos de ellos, con todo el gusto del mundo lo estamos compartiendo para que podamos repasarlo las veces que sean necesarias.
Excelente, muchísimas gracias.
No, a usted por participar con nosotros. Gracias por esta pregunta tan interesante, de verdad. Muchas gracias.
Perdón, le tenemos que preguntar si pudiera terminar con compartir la pantalla, porque si no, no puedo...
Gracias, María Paula. Mil disculpas, se me pasó. Catherine, ¿nos puede hacer favor de devolvernos la administración para que ellos puedan mostrarnos
Claro,
más? Gracias, María Paola.
Ay.
Yes. In evidenza per tutti. Okay. Good.
So
I'm muting.
when I start. So I put 20% in the diathermy, okay? 5 minutes to give the skin to get used to the energy, to increase the vascularization. We don't need to have a strong heat now. We can do after. This is just a warm-up. remember that the spheres are different. So means that the concentration of the energy is on the small. It's like a monopolar concentrated in this area. So when you treat, you have to remember this. So you can turn, you move when you want an energy on a specific part. For example, nasolabial, I do like this, no? The oval, first on top, then on down. So I turn.
Doctor, we use with the metal plate both.
Yes, both, but consider the small is where the energy concentrate.
They put a return electrode
No,
on
no,
the
no.
patients with this one.
No, no return, no return. With this, no. No return. I just prepared for after, but no. Don't use return electrode here. Okay? Because if you use return electrode, there is only one working, but it's not.
This is why you didn't get the results, because you changed the
used-
polarity. Yes, she was using the spheres with a return electrode.
No, absolutely.
That's why.
No. Absolutely no. Because you don't have efficacious heating. No. Return electrode only on monopolar and peace. So when you do, when you want to treat the lower part of the oval, the small spheres goes down. Okay, and you do like this. When you want to treat the upper, you turn and the small spheres goes up, and you treat this area. Okay, it's important to know this.
Now they want the parameters. So we are in diathermy mode, 20% of intensity.
Now this is for warm up, but this kind of treatment, only diathermy, you can reach 60, moving fast, but you need warm or no result. You need to create a denaturation. You need to increase the temperature in the subcutaneous, in the skin, in the first part, in the dermis. And the same you can do here, no? With gel, you do lower eyelid, upper, okay? Lower, always. And we do this, we warm up because after when we do the thermocontraction and we want to lift this, we have to have a good warm up of the muscles in this area. So that after when we will work and we lift this, you will see a very interesting result. Okay. So after that you do a warm up on 20-25%, you can increase, but never increase immediately. It's better you do 30 minutes, you say, no? On the face.
Yes.
So 30 minutes on all the face. So it's a lot, but you start with 20, you increase to 30, 35, you know, every 1-2 minutes you increase so that the patient doesn't get, they don't are feeling a burning effect, but an intense warmth. This is what you have to obtain.
But we already see that the cheeks treated is more elevated than the other side.
No, but the return electrode is a big mistake. Also with the thermocontraction, not good to use the return electron. Absolutely. Okay, so after the war, you can treat them with muscular contraction. Consider that the volume that you see after the war, after heating, is going to disappear a little bit with the thermocontraction because you are going to drainage also. You know, so because you have a flash effect during the blood that is on the skin, but the results are lasting more. So for the thermocontraction, adesso entriamo un po' di contrazione muscolare.
With 50% of chemical effect.
Okay. So I put the basic of the machine, 50% thermic effect, 10% the power, and the rest is like the default, 3 DF more. So it's like okay, this is to try. See?
Always go progressively with sensitive people.
So there is not too much contraction, so we can increase to 12 or 13 because no, 17 is 15. Okay, 15. So when you treat this, you don't have to do like this with muscular contraction. No sense. The sense is to catch the muscles that you want to train, and then treat it. Now we were using a mode that is 3 Hertz because we want to get the muscle used to this. Then we will increase to 50, and you see the difference. Okay, see the difference? Huh? See? Non si vede la stimolazione così? See? So I treat this, and as you move, you see a different muscles that is moving because it's this that drive the contraction, not this, but the small. So see, for example, I stay fixed. This is another method you can do. Stay fixed where you find the muscle that you want to contract, and with the foot pedal, you press and you release. So I press, muscle, contraction, like gym, no? Then I release and relax. Then again, up. And we do the same on the hybrid, much more. I'll show you. Apposta, strana, è bizzarro.
May I ask a question?
Sure.
All these treatments should last at least 30 minutes. Is that right? In the face?
How many minutes did you say?
30.
30.
Normally, my basic protocol lasts 45 minutes because I usually, in my basic protocol, I have 5 minutes of dermabrasion, and then I do only diatemy, pure radiofrequency, 30 minutes. And then after that, I do some sonophoresis to infuse any kind of serum.
This is the protocol that clinics usually sell like small breads because patients really love it in their clinics. But then I have different levels of protocols. If you want to add the T point, then in that case, you will do 1 or 2 minutes per deep wrinkles, like 2 minutes per nasolabials, and 2 or 3 minutes on the crow's feet. And then if you want to add diathermal contraction, in that case, I reach a protocol that will last 75 minutes. Yeah.
Okay, so for contraction, the last one, 7 to 5 minutes, 5 to 7, I mean.
In that case, if you just do muscular contractions, it depends on where you want to do muscular contraction. If you want to do the full face or if you just want to split the treatment. So if you just want to do the eyebrow, for instance, I do it 5 minutes per eyebrow, which means 10 minutes of diathermal contraction for both eyebrows. But then if you want to work on mid face and lower face, I do 15 minutes on each face of diathermal contraction.
Okay, thanks so much.
Look the eyebrow, no? When I catch my muscles, so the purpose is to lift this, no? And more you go up, more you can see the effect. So see, for example, see here is going down, no. So I move to catch the muscle that, so like this. When I release, boom, it's going down. I press the pedal and it's going up, see? This is the strategy. Then down. It's a gymnastic. Up, down. And this
Doctor,
just on the same position.
then
I don't have to, no sense to move continuously with the thermal contraction because the muscles, our purpose is not to just, stimulate, but it's really to train, to reinforce the muscles to lift. That's what we want. Especially when people are they abuse too much of Botox, and you know that, I mean, if you abuse of Botox, after years, the muscles is not, if the muscle doesn't work, it's going down, I mean, lose the tone. And with this machine, we can restore. So it's important, I show you. This is not good. See, this is not good because it's going down, see? We don't want this. So no. Here, okay, because it's going up. And here was good because we wanted to stimulate this. So we have to catch this muscle that is going to go up like this. So I don't care about this muscle, the mouth that is doing like this. I don't care of this. I want to do this. I want to do this. The sense of the thermal contraction on the face is to catch few muscles that are giving tone and sustain to the face, to the look, but not that type. Because I saw people doing like this with muscular contraction, and it's also not comfortable for the patient, no, to see all these muscles like crazy.
You have to work on motor muscles and not on depressive muscles to give more structure on the face.
For example, let's work again on this.
And doctor, you can show the screen of your machine of the Imperium?
Sure. That were the settings for the eyebrow. 8% of intensity, 50% of thermic effect, and F mode 50.
Thank you.
See, this is going to contract. No, no. Doctor, okay. Oh. Okay, see? Then I release, it's going down. I press, oh. Okay, so you do a bit here, then you come back here, then return here, then you go there. So divide in 4 the face, okay, divide in 4, and you have 4 areas to treat. Don't do muscles here, don't treat this part, okay? You can treat this part. You can treat a bit the décolleté upper the breast, because it's also interesting. That's it. But important, starts with warm. Starts eating before, because you need to bring vascularization and oxygen to the area. Okay.
Anything you would like to see in terms of protocols, manipulation for face or body?
Yeah, especially if you have done.
Nos consultan si tienen alguna consulta o quieren ver algún uso adicional. Aprovechemos que los tenemos ahora.
Hands up. Okay, I want to show you the T-point, since you are not. No, I give already.
Okay.
Thank you.
T-point. Okay, this is a delicate tool. In the machine, maybe if you show. When you switch on, you have a trigger point. Don't use this, because this give current, this muscular contraction, and on the face it doesn't need. So you go on wrinkles stretching. You press start. You have the G, keep G1. In this case, you can keep G1 to start. I will show you why. And then just regulate the power. We start with 15. Okay.
Wrinkles program G1 and 15 of intensity.
Okay, I will do, let's say I want to do a nasolabial, okay? So I'm in this, I press and I start to move, okay? So it's already beeping because we already made the spheres before. So the area is already too much warm. Okay, because this tool has to be used after the spheres, always, so that we already can start with a high level. So we go up to G3 immediately, 15%, because it's not important the power now, because the tip is so small, the needle is so small that the concentration of energy is very high. In this case, we have a return electrode. This is important. You need the return electrode behind the shoulder because it's monopolar. Okay. So it's going. Can you show them the bars, the yellow bars? So look, the yellow bars when I work, they are increasing. I want to reach my target G3, the beat, on the same area. So I move fast. Okay, see, B. So we
Okay.
reach this target of G3. We can repeat, we can go on the other side, then we can return with G4. So it's not important the power now, because 15, 20%, it's just a matter of being faster. But what we want is to reach the target. Here, the G and the TSL is very important. TSL is very important because when we reach the target, means we reach a temperature that is what permits us to generate the denaturation of the collagen. Okay. So G3, 15, and make a brucia. No. So it's also comfortable. And believe me, G3 is around 43, 42, 43 degrees. So let's imagine I want to try to go G4. I can increase the power to 20, but here I have to be careful, okay? If I don't reach the G4 in few seconds, I will stop and I will repeat again, but I don't have to insist because the moment from comfortable to too much heat is immediate with this. I mean, you don't control. I mean, when the patient is feeling okay, then immediately say, too much. So this is important. Tu alza la mano quando è troppo. So I check the bars, the yellow bars. I'm already G3. I'm going. I told her to lift the hand if it's too much. Okay, she said too much. We were close, eh? It was missing a couple of bars. But it's okay. She said stop. You stop. You don't have to reach the G4. You will reach with time. So we give her the time to relax and we repeat. Okay, we go. I go faster. See? Beep. And was comfortable for her. So it's a matter of habit that the patient has to feel comfortable and you reach the target. I love this end piece. I really love it. You can do this part, you can do the eyebrow, everything that is line that you want to do really the tightening on the lines. Yeah. But you have to use as I show you. So not low level, 20 minutes. No, this is another thing. This is few minutes, few seconds, and immediately up. Boom. And then you move, and then you can return on the same. And you will see redness, and you will see the results after immediately. Okay? Try. It's very interesting. Okay.
Don't you do some shots just on the other side, just 3 shots.
Okay.
Keep the chair and we can.
¿Alguna otra pregunta que quisieran solventar?
Doña Regina, la doctora Vargas tenía una consulta sobre cómo trabajar la fibrosis cuando hay celulitis.
Yes, with the thermal.
Gracias.
So I just finished this and then we tell you about that. Regarding, I want to show you just a couple of shots with this. This is made of 25 crowns. Okay. Each of these has a cushioning. Push pull. Yeah.
What's the cushioning?
no, in spagnolo.
No.
Ammortizzazione, no? That can adapt to the area. So when you select, you have 6 levels from soft to intensive, but we use soft on air just to show you what is important here, that you stretch the skin, you position this, then you press and you give shot. Okay. So when I press and then I release. Imagine to do this on all the area covering, shot by shot. It's a little bit painful because of the mechanical pushing, okay? So imagine every push we give, there are these 125 microneedles that penetrate, and also for the radio frequency shot, that is depends on the power you select, but can be really intensive and a bit painful. After, the result is an homogeneous redness for 2 hours, but this is really good for the tightening, for what they were saying.
For skin laxity, sagging skin,
exactly.
especially that it's a non-invasive radio frequency.
Yeah, it's a non-invasive.
You reach the papillary dermis, so you don't bleed, because that's the main problem that you have with microneedling RF, is that the patient, this is a really good technology, but with invasive microneedling, people bleed, and so you create deeper injuries. But with this handpiece and with the crown and the cushioning system, you really reach the papillary dermis, the deepest layer without bleeding.
See the matrix? It's like a stamp. Every positioning, it's a stamp. And you can do on all the face, on the hands and face, décolleté. I mean, it's really, it takes a bit time because it's small the area to treat and you have to shot one by one.
But we can do a full face in 15 minutes.
15 minutes, yes.
And what is interesting is also handpiece is also not a consumable, so you can use it for on the same patient for different sessions.
Yeah, for all the cycle, 20 treatments, 25 for each patient, and then
you were having a question. Sorry, I interrupted you.
No, I'm sorry, but that's so interesting to make a complete face in 15 minutes. It's quite short time, I think.
It is. I mean, if you want, I can just show you on the mid face to see the numbers of shots that you can do in the mid face.
Oh, but consider that there is the speed you go, no? Because I press, I will do just this for maybe I don't press too much, okay? Because so I do 1, 2. Okay.
First you press and after you shot.
I press before the beep, just once.
Exactly.
I release, because when there is the light, means that the radio frequency is going. Okay, I stop because.
No.
But in 15 minutes you do 20 maximum. You do all the face. It's a matter of get used to the how to take the time, no, of the speed. So it's really easy.
And does it hurt?
A bit, yes, a bit, because I told you for the pressure and for the energy itself.
The feeling is as if you were receiving an IPL treatment on yourself. So, but if you want, you can also numb. I mean, depending on the clinic, some people.
The important numbing is that you clean very well the skin after, because you don't have to use gel, any conductive cream, because the energy is all concentrated on the needles and they are very thin, the needles. So we have to avoid an increase of transferring the energy on the surface. Otherwise, it's too much, and you can hurt a little bit. So dry skin.
And do you remember when I was telling you that the genesis of the Imperium Med 400 is to work on with combined therapies using different technologies? Like the dermabrasion is always the first step, and then you have some different radio frequencies to work on this collagenesis of the skin. But also, as Attila was showing you, when you are using the fractional RF, you create those micro holes on the skin. And remember another technology that you have, the dermabrasion, the sonoblade handpiece, that you can use in sonophoresis mode. And the regulation of the products will even be more powerful thanks to the micro holes that you did with the fractional radio frequency. So, and this protocol, I call it deep restoration program. So this is like the top protocol facial that you can have with the Med 400 using dermabrasion, diathermy, diathermocontraction, and also fractional radio frequency, and you finish with the sonophoresis.
So the other question was the fibrosis on cellulite, no?
On cellulite,
Yeah.
exactly.
Right. In that case, you have to, possiamo muovere questo? So, dovresti mettere di girato. Mettila nella posizione così. Questo possiamo togliere.
Questa cosa sarà buona.
Noi.
Scusa, ho fatto una giornata veloce.
So. Così, così. So, let's imagine to have a fibrosis here, no? So orange peel and so what do you do? Okay, as I told you, if you have the quad, it's really big, so you can really treat all the area and vascularize, because don't forget that vascularization is the problem on cellulite. So we need to increase vascularization and capillarization. Okay, so with these spheres are also intended to do a connective massage, because you press, no, you see, and it's incredible what you can do with this. Okay, but if you don't have this, you will lose the capacity, monopolar. So you put the return electrode on the opposite here. And then with this, you use diathermy in high energy. So starts from 50 and you can reach even 80. The important is to increase the temperature here a lot. Okay, vascularize, bring liquids. You can also start from lower the legs, okay, and go up, lower and go up, okay, like this. So once you have reached the warm area, 15 minutes, 15 minutes of this, we're going to take our glove. We take some guards, is good. Imagine we have a guards, gel. You select the area that usually is this, and I will start with breaking and then fibrosis. So first breaking, because we have to give shots. So you can take a guards or anything. So the good of this tool, as you can see, is this shape that permits to open the ray, not to get focalized, but the contrary, to defocalize, to open, because we don't want to reach the bones. We want to stay on the fat. So we have the beam that is in the middle, the main beam, but you have action also around. So you don't need to stay perpendicular, but you can work also on the fat like this, and you move, you move on all the area, okay? Contrast with the end, you contrast and you move with jet, okay, simple. After breaking, let's say you need to do 15 minutes here, so you do 5 minutes of breaking, and then you go on fibrosis. Fibrosis, you continue the same way, but because fibrosis is 5 of duty cycle, that is a peak of energy like a shock wave. It's really close to the shock wave, the ballistic, like a Storz, like you know, EMS. So in this case, you really break the septa, no, the fibrosis, and you work like this. You have this that is very helpful to massage. Okay, so you work on area. Okay, and do for 15 minutes this area. After, very important, you take the multi-action, or again monopolar, so the return electron, multi-action, and we select on the screen of the machine, we select drainage program, drainage. Why? Because now we need to drain. So we increase the vascularization, we bring liquids, we destroy the fat cells, we open the vascular area, no, the vascularity, the flow, no, that we need to bring in the cell, right? And then with this, you take with your hand like this, monopolar, drainage. So drainage is already preset. Just put power that you have to see the muscle doing this. Okay, this is what you have to see, and then you move so that there is a massage. No, but the massage is you from the top with the hands, and the machine that is pushing the muscles from bottom, from inside. So you have a squeezing effect. Imagine the muscle that is going up like this, and you that press from the top, and so you have this. Okay, and you use the lymphatic drainage. Okay, here, and do it for other 15 minutes. Is important. 10-15 minutes. More you can is better. There is no contraindication. The only thing is that to repeat this treatment, you have to wait the liver to waste the fat that we put in circulation. So the right time is 20 days, 15-20 days, huh, to repeat again.
Every 15 days you can have the capitation.
Okay. Okay, this is the protocol. Important. Radio frequency, ultracarb, multi-action. It's the three magic of the cellular. During
You can use all this in one session?
One session, yes, absolutely.
Excellent.
The only thing you can do during the 15 days, when you are waiting the 15 days, is to recall the patient after 1 week to repeat only the atomy. Okay?
Okay, and for the last, you can use thermogym after this?
Yes.
Yes, you can use thermogym for lifting the gluteus. And it's a good, you know why? Because in the session, you give the muscle the fatty acids that you get free in the body as fuel for the muscle. So the pyruvic cycle, you know the pyruvic cycle, no? So you make the fat free fatty acids. They go in the pyruvic cycles and they become in the Krebs cycle. They become the fuel for the muscles. So it's good. It's very good in the same session after drainage to do toning to increase the volume of the gluteus and give more efficacy to the treatment. Remember that when you use the thermogym in toning, use the big tone plates. 1 and 2 is one channel. The other channel is on the other side. Remember, don't mix like red and black channel, one channel like this, but always one on one side, one on the other.
Perdón, el doctor dijo cada 15 días.
15.
15.
15, sí, cada 15.
No una vez a la semana, digamos, como habíamos visto anteriormente que un
Puedes
protocolo-
hacer todo el proceso de una vez en un solo día y luego mencionó que cada 15 días.
See,
Okay.
you can do things like this. Okay.
You really gain time with the big quad, and also it makes the operator, it makes the treatment much more comfortable for the operator as well. Because usually beauticians or nurses are good for facials, but when you want to do body contouring, you need to spend lots of physical energy because you have to combine manual treatments and the technologies. But when you look at the size of the big quad, which the diameter of the handpiece is 15 square centimeters, and you really have a fast and homogeneous heating after 1 minute.
So this is a great protocol for cellulite, for orange peel, for also localized adiposity. But in any case, when you have a really problem of circulation, this helps a lot. 10 sessions and they get super. They get super. Try and send us some pictures. Huh?
Any other question?
It's 8. Huh?
Catherine, ¿alguna otra pregunta o algo más que quisieran aclarar?
Muchísimas gracias, ¿no? Todo está muy claro. Creo que lo de los movimientos nos va a ayudar un poco más a tratar del tema de la fibrosis, porque sí, efectivamente no estábamos haciéndolo de esta forma.
Maravilloso. Excelente. De eso se trata. Gracias, Catherine.
Muchas gracias a ustedes.
Okay, they have no more questions.
Okay.
So I want to thank you once again and more about your time. Thank you so much. This has been so useful for them.
We see Monaco in September, and if you are able to travel to Monaco, we will be really glad to meet you.
Thanks.
Thank you, everyone. And if other questions are popping up, just message Regina, and we will answer you directly. Okay?
Sorry, I have one question.
Tell us. Díganos, Catherine.
About the thermogym. We use 30 minutes. Is that right?
It's good. After the cavitation and the radio frequency, or you want 30 minutes of thermogym?
Sí, está
After
correcto.
all the treatment?
Perfect. Because if you use thermogym,
Okay.
radio frequency and cavitation, I do 30 minutes of thermogym. But if you want, you can also do 60 minutes of only thermogym. So you save time as well. So I like combining both because patients, it's convenient for you to use only the thermogym, but also patients are happy to be with your.
Okay. Thank you. Excellent.
Thank you, Katarina.
So if we have, I don't know, maybe another question.
Just let me know.
We contact.
let us know and we will address all the questions to them and they will help us accordingly. Don't you worry about anything.
Okay. Thank you very much, everyone. And hope to see you. Okay. In Europe, Costa Rica.
Thank you, everybody. Have a good night for you and good day for all of us in Latin America. Thanks a lot for your time.
Bye. Thanks.
And for your knowledge.
Muchas gracias. Thank you. Gracias.
Bye. Bye.
A usted, gracias.